Hey, it's Dr. Austin Cope. Today we're going to talk about neuromodulator injections, also called neurotoxin injections. And this is, of course, Botox, Dysport, and Jeuveau. And these are some of our favorite things that we do here at Riverside Medical Arts. So when we say Botox, we're often referring to the whole category of neuromodulators. Botox, of course, was the first neuromodulator, and it's the most well-known. It's a brand, but there are some competitors. There is Dysport, there is Xeomin, and there's Jeuveau, and we use just about all of them here in clinic. They're very similar, they're all very safe, and they work very consistently. So what the neuromodulators do is they work on these dynamic lines, the lines of movement. And so when we scowl down, we develop lines here, and raise up, we develop lines here, and so on and so forth. They work very, very well for the dynamic lines of the upper face. We can also use them in the lower face. The lower face, though, is mostly filler. That's where they complement each other. So how do the neuromodulators work? They work by disrupting the signal from the nerve to the muscle. Right? The nerve has to tell the muscle to contract, and Botox and Dysport and Jeuveau, they block that signal. So the nerve sends the signal, but it never gets to the other side, to the muscle. So as a result, you just can't really contract that muscle the way you normally do. So here's a photo of someone before and after they've had a neuromodulator injection right here in the glabella. In the second image, she's trying to crunch down, she's trying to make that scalp, but she just can't do it. It's a fascinating sensation if you've ever had it before. So another interesting thing about neuromodulators is this has been studied extensively. They can actually make you happier. And the way this works is through something called the facial feedback hypothesis. And as you can see in this image right here, this was studied where study participants held a pencil in their mouth for about 5 minutes, and afterwards they just felt happier. Why did they feel happier? Because the pencil was forcing them to smile, right? If you force yourself to smile for a few minutes, you feel happier. Conversely, if you are unable to crunch down into this negative emotion face, if you can't do that, you can't really feel the negative emotions quite as strongly. So this is how we believe that Botox and Jeuveau and Dysport can actually make you feel happier throughout your day. So these are just a few points of the neuromodulators, neurotoxins. There's a lot more to talk about. They're fascinating. They work. Hopefully you think it's as amazing as I do. And if you're interested, if you think you're a candidate, then give us a call. Happy to chat more about it. Thanks.